Hello, and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to Advanced Cardiovascular Life Support, ACLS, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's start it. Question 1. A nurse is caring for a patient in cardiac arrest. During the initial assessment, what is the first action the nurse should take according to ACLS Guidelines? A. Administer epinephrine. B. Perform chest compressions. C. Establish an airway. D. Defibrillate the patient. Answer 1. C. Establish an airway. Rationale. According to ACLS Guidelines, the first action during the initial assessment of a patient in cardiac arrest is to establish an airway. Maintaining a patent airway is crucial for effective ventilation and oxygenation. Question 2. A patient is in pulseless ventricular tachycardia VT. What is the initial treatment priority according to ACLS Guidelines? A. Defibrillate the patient. B. Administer amiodarone. C. Perform synchronized cardioversion. D. Initiate chest compressions. Answer 2. A. Defibrillate the patient. Rationale. For pulseless ventricular tachycardia VT, the initial treatment priority is to defibrillate the patient. Defibrillation is the key intervention to restore a normal cardiac rhythm in ventricular fibrillation VF or pulseless VT. Question 3. A nurse is caring for a patient who has just been successfully resuscitated after a cardiac arrest. What medication is commonly administered during the post-cardiac arrest phase to prevent rearrest? A. Epinephrine. B. Amiodarone. C. Lidocaine. D. Sodium bicarbonate. Answer 3. B. Amiodarone. Rationale. Amiodarone is commonly administered during the post-cardiac arrest phase to prevent rearrest and stabilize the cardiac rhythm. It is particularly indicated for ventricular fibrillation VF and pulseless ventricular tachycardia VT. Question 4. A patient in asystole is not responding to initial interventions. What medication is recommended in ACLS guidelines for the management of asystole? A. Atropine. B. Dopamine. C. Epinephrine. D. Amiodarone. Answer 4. C. Epinephrine. Rationale. In the management of asystole, epinephrine is the medication of choice according to ACLS guidelines. Epinephrine increases coronary and cerebral perfusion during cardiopulmonary resuscitation CPR. Question 5. A nurse is caring for a patient with a witnessed sudden cardiac arrest. What is the recommended sequence of actions according to ACLS guidelines? A. Defibrillation, chest compressions, airway management, medications. B. Chest compressions. Defibrillation, airway management, medications. C. Airway management, defibrillation. Chest compressions, medications. D. Chest compressions, airway management, medications. Defibrillation. Answer 5. B. Chest compressions, defibrillation, airway management, medications. Rationale. The recommended sequence of actions for a witnessed sudden cardiac arrest according to ACLS guidelines is chest compressions, defibrillation, airway management, and medications. Early chest compressions and defibrillation are essential for improving outcomes in cardiac arrest. Question 6. A nurse is caring for a patient with symptomatic bradycardia. What is the first-line medication recommended in ACLS guidelines for the treatment of symptomatic bradycardia? Atropine. B. Adenosine. C. Lidocaine. D. Amiodarone. Answer 6. A. Atropine. Rationale. Atropine is the first-line medication recommended in ACLS guidelines for the treatment of symptomatic bradycardia. It increases heart rate by blocking vagal stimulation. Question 7. During a code blue, a patient is found in pulseless ventricular tachycardia VT. What is the appropriate initial intervention? A. Perform synchronized cardioversion. B. Administer amiodarone. C. Defibrillate the patient. D. Initiate chest compressions. Answer 7. C. Defibrillate the patient. Rationale. For pulseless ventricular tachycardia VT, the initial intervention is defibrillation. Defibrillation is crucial to restore a normal cardiac rhythm. Question 8. A patient is experiencing a severe anaphylactic reaction with hypotension and respiratory distress. What medication is recommended in ACLS guidelines for the treatment of anaphylactic shock? A. Epinephrine, B. Norepinephrine, C. Dopamine, D. Dobutamine. Answer 8. Epinephrine. Rationale. Epinephrine is the medication of choice for the treatment of anaphylactic shock in ACLS guidelines. It has both alpha and beta adrenergic effects to improve blood pressure and bronchoconstriction. Question 9. A nurse is caring for a patient with ventricular fibrillation VF. After defibrillation, what medication is recommended in ACLS guidelines for the treatment of persistent or recurrent VF? A. Lidocaine, B. Epinephrine, C. Amiodarone, D. Vasopressin. Answer 9. C. Amiodarone. Rationale. Amiodarone is recommended in ACLS guidelines for the treatment of persistent or recurrent ventricular fibrillation VF after defibrillation. It stabilizes the cardiac cell membrane. Question 10. A patient is experiencing a myocardial infarction, and the nurse observes the development of sustained ventricular tachycardia. What is the initial treatment priority according to ACLS guidelines? A. Administer amiodarone. B. Perform synchronized cardioversion. C. Initiate chest compressions. D. Defibrillate the patient. Answer 10. D. Defibrillate the patient. Rationale. For sustained ventricular tachycardia in the setting of a myocardial infarction, the initial treatment priority is defibrillation. Defibrillation is crucial to restore a normal cardiac rhythm. Question 11. A nurse is caring for a patient with a witnessed cardiac arrest. After activating emergency medical services EMS, what is the next step in ACLS guidelines? A. Initiate chest compressions. B. Establish an airway. C. Administer epinephrine. D. Defibrillate the patient. Answer 11. A. Initiate chest compressions. Rationale. After activating EMS, the next step in ACLS guidelines for a witnessed cardiac arrest is to initiate chest compressions. Early chest compressions are crucial for improving outcomes in cardiac arrest. Question 12. A patient is in pulseless electrical activity P. What is the primary intervention according to ACLS guidelines? A. Administer epinephrine. B. Initiate chest compressions. C. Perform synchronized cardioversion. D. Identify and treat reversible causes. Answer 12. D. Identify and treat reversible causes. Rationale. For pulseless electrical activity P, the primary intervention according to ACLS guidelines is to identify and treat reversible causes. This involves addressing factors contributing to the cardiac arrest. Question 13. A nurse is caring for a patient with a ventricular assist device VAD who experiences a sudden cardiac arrest. What is the appropriate response according to ACLS guidelines? A. Perform chest compressions. B. Administer epinephrine. C. Activate the VAD's emergency system. D. Defibrillate the patient. Answer 13. A. Perform chest compressions. Rationale. In a patient with a ventricular assist device VAD experiencing sudden cardiac arrest, ACLS guidelines recommend initiating chest compressions. The VAD's emergency system should be activated if directed by the device-specific protocol. Question 14. A nurse is caring for a patient with a history of ventricular fibrillation VF. What medication is commonly prescribed for long-term prevention of recurrent VF? A. Amiodarone. B. Lidocaine. C. Epinephrine. D. Atropine. Answer 14. Amiodarone. Rationale. Amiodarone is commonly prescribed for long-term prevention of recurrent ventricular fibrillation VF. It has antiarrhythmic properties and is effective in maintaining normal cardiac rhythm. Question 15. A patient is in asystole, and the initial attempts at resuscitation have been unsuccessful. What medication is recommended in ACLS guidelines for refractory asystole? A. Lidocaine. B. Epinephrine. C. Amiodarone. D. Vasopressin. Answer 15. B. Epinephrine. Rationale. In cases of refractory asystole, epinephrine is recommended in ACLS guidelines. Epinephrine increases coronary and cerebral perfusion during cardiopulmonary resuscitation CPR.